So the biological dentist is a catchphrase for someone that's trying to do things in a way that they're using dental materials or removing old materials in a way that's healthy for the person's body and also healthy for the dentist and their support personnel, so they're not exposed to these toxic metals and toxic fumes. So for example, a lot of people may not know this that'll be listening, watching your show, but we've been using mercury fillings, mercury-filled fillings, and of course they changed the name and call them amalgams, silver fillings, et cetera. But really, you should call it by the main element that's in there, and it's 50 to 53% mercury. So in the 1800s, it was brought over from Europe. It was a cheap alternative to gold. Otherwise, people have pulled their teeth. So they ousted the gold group, made them look like a bunch of greedy, whatever, I won't use the expletive, but made them look like bad guys. And they morphed into this group where they started sticking this black stuff down in people's teeth. And at least it was, you could scoop out the decay and put that in there and it would keep that tooth. The gold guy said, what about the mercury? The mercury guy said, oh, it binds in there, it's fine. Well, there was no science then. There is science now. We know it comes out so much that one mercury filling is the same as eating a meal a day of mercury-contaminated fish. So if you have 12 in your mouth, that's 12 times. And it accumulates within the body. Most people can detoxify it, but at some point that garbage can gets filled up and they get sick, and then they get mysterious illnesses. So that's one thing on the biologic side. How do you remove those things safely? So you're not exposing the patient, exposing yourself. And that's what they look at. And then what materials do they put back in? Because we want to put back in materials that are healthy for the person's body, or at least as healthy as we know. And how they test that, it's unique from one biologic dentist to another. There's not like a standard of care there, other than a blood test that can be done that is duplicatable in every single office. You get the same results. And then you get a list of thousands of materials that you can use. That's a very, very accurate and safe one. But some people do other testing and things like that. But so a biologic dentist, they're working very hard to incorporate the entire person's body and help them live a more quality-filled and health-filled life.
Now, speaking of mercury fillings, I understand you won't even do any cleaning or anything until they're taken out, correct?
That's correct. Or if we have to, we avoid those areas. We don't touch or scrape or scratch them at all. And by the way, just to finish my comment earlier,
yes,
that gold group that got ousted by the mercury group in the late 1800s, they formed an organization. That organization is now known as the American Dental Association. And therein lies why it's so difficult for us to, even from a environmental standpoint of not sending those toxins out into the environment with mercury and whatnot, to try to make it obsolete, right? Some countries are making it obsolete for children. We'd like to make it obsolete around the world because bonded dentistry is way superior than sticking something in there. Mercury expands violently compared to the natural expansion of one's tooth. So you put a big one in there, it's going to crack the tooth. It's not a matter of if, it's a matter of when. And when those mercury fillings were first being done, the father of modern dentistry, back in the turn of the 1900s, G.B. Black laid out principles. And so the cavities had to be really tiny. If they got big, they weren't advocating even sticking those in there. Now they get put in along the gum line. They get put anywhere that there's a hole, those things get jammed in there because they're cheap. They're kind of easy, but we see a lot of failure with those and a lot of tooth loss as a result.